Hi, my name is Amanda Vasquez. I'll be performing wound care on our mannequin. If you come in closer, you can see that it is a stage 4 because you can see the bone and there is muscle showing along with these tunnels. And then there is some dead cells and some dead tissue here that red blood cells are not getting to. So the first step that we're going to do is take our saline and we're going to clean the area before we pack it. So we're going to take our saline, we're going to squirt in these areas, make sure it's nice and clean, and then go in and dry it up and like so. Good. We dispose of this. Okay, next step we're going to do is going to take our little cotton tipped wood applicator. So here we're gonna measure these tunnels. So here, so it's about there, and we're gonna take our wound measuring guide. We're gonna go to centimeters, and you can see there that it's exactly at 4 centimeters or just about. And I would have my assistant or whoever else is in the room with me write that down for me. And then I would also check these other ones. That one is about 2.5 centimeters. And I would just go around and check them all. I would also check from the center. That is important just because we want to make sure that it is healing properly. Maybe about there, and that is about 3 centimeters, I would say. All right, and then I would dispose of the Q-tip, and then I would take my measuring guide, go from the center, and that's about 10 centimeters there. So across, and then wide is about just about 8 centimeters right there. Okay, so after I record all my measurements, I can go ahead and start stuffing the wound. I would take this gauze here, and if you see over here, there's a tunnel here, which I can stuff right there. Take my Q-tip and just gently, I don't want to pack it too hard, but just like so. And I'm gonna leave a tail just so that when I'm ready to change this gauze, I can easily find it and I can easily pull it out. Okay. So then now I'm going to take my Perlex that I had saturated with saline here, and I'm just gonna place it over. Make sure I'm tucking it into any other little tunnels that we have here. I'm gonna go back and forth motion like so. Just make sure it's nice and snug in there. Make sure I'm getting all the nice little spots so she can heal, she or he can heal properly. Okay. I'm gonna take my scissors, cut it. Okay, so it looks like that. That looks good. And then I'm gonna open this up here. My ABD padding. I'm gonna place it over like so. And I'm gonna get my tape. And make sure it's nice and snug so that it's not gonna fall off if she or he moves and twists and turns. Like that. Or maybe one more just to across. Make sure it stays nice and put. Like so. Alright, and then I would initial. I would date it. Today is the 12th, so 10/12/22. And the time is 10:40. Alright, so my patient is done. She is all cleaned up and ready to go back to bed or do whatever she wants. And I'm just going to clean up my materials and we are done.